Hello, my name is Dr. Arandi. I'm assistant professor in psychiatry at النجاح University in Palestine. Today I will present a short summary about fibromyalgia. As we know, fibro in Latin, fibro means connective tissue, and myo mean muscle, and algia mean pain. So it is a chronic definition. It is a chronic widespread of pain all over the body. Before in 1990, it was said that it is involved with the four quadrant of the body. Now, in 2010, it said that may involve with all the area of the body. What are the characteristic symptoms of fibromyalgia? There is a lot widespread pain all over the body, as we said, and it is chronic in nature. This pain are exacerbated and can be elicited by a slight pressure on this tendon, on this spot of pain, which is maybe reach to 18 spots or point. So it is a mild tenderness which be exacerbated by the pressure. The pain is widespread. It is in the head, in the neck, front and back of the neck, in the trapezius muscle, in the upper left of the chest, in the back, in the outside the elbow, the angles of the elbow, in the pelvis, in the buttocks, also in the legs, and the notice point that in the legs it is occur inside the tendons. Fibromyalgia, how we diagnose it, it should be there is more than 6 points of tenderness or pain spreading in the body, and should be run for 3 months or more, and it should be affect our life in our activity. There are many symptoms accompanied fibromyalgia. With these symptoms could be tension headache, could be there is an anxiety, there is depression. Fatigue is obviously in the morning and during the day. This is fatigue accompanied by stiffness of the muscle and joint, and this appear most obviously in the morning. Could be bowel symptoms, diarrhea, constipation, numbness in the legs, in the hands, in the upper limbs. Could be there is insomnia, and there is impairment or difficulty in concentration and memory, and which is called fibrofog, actually, which term is led to there is a disturbance in the cognitive function. There is a lot of comorbidity condition sometimes with the fibromyalgia. As we know, fibromyalgia, it could be as an only diagnosis, but could be accompanied by associated by comorbidity of depression and anxiety or postpartum disorder. It could be co-associated with irritable bowel syndrome, could be with fatigue syndrome, with a chronic pain disorder, and it could be secondary to organic causes, organic condition like rheumatoid arthritis and rheumatism. What about the causes of fibromyalgia? Fibromyalgia, there is no sure causes, so it is known, as I said, it is unknown. However, the genetic factor and the family predisposing factor could play a role in the etiology. Stress, either psychological stress or social stress or life environmental stress, contributed to the etiology of fibromyalgia. What about the biochemistry of fibromyalgia? It is called that the brain is a central sensitization with the nervous system, so that the brain with the nervous system be more sensitive to sensation of pain, moreover than the normal cases. For instance, any mild stimulus can exacerbate it and received by the brain as a huge, so there is more sensitivity to the pain, especially this is obviously when there is a pressure on the focal area or focal point area in the body. With regarding the chemistry, as we know, the mediator is could be serotonin, norepinephrine, and substance B and glutamic acid. There is a decrease in serotonin and noradrenaline, and there is increase in substance B and glutamic acid, which is responsible for agitation and excitation. With regarding the management, it is a what is seen that actually in fibromyalgia, that when we do a laboratory test, it is show no positive result. For instance, ESR, CBK, and other lab tests, white blood, CBC, white blood cells, all of them are normal. There is no swelling in the joint, even though the patient feels that there is a tenderness. Sometimes migraine accompanies fibromyalgia. Rheumatism could be accompanied by fibromyalgia. With regarding to the treatment, it is biopsychosocial and rehabilitation treatment. We should give attention to the sleep. We should attention for the sport exercise, aerobic exercise, meditation, and normal improve the activity of the patient, especially in the morning, because in the morning there is a lot of stiffness in the body with pain in the muscle and joint and tendon. So to starting improving the activity, it is good for the patient. We consider the vegetation. Sometimes somebody consider the vegetation, vega nutrition could be good. There is no support for this theory. With regarding to the drug, selective serotonin reuptake inhibitors like Prozac with amitriptyline can give some result. Selective serotonin reuptake inhibitor or selective serotonin norepinephrine like duloxetine, trade name in Cymbalta, miniciblamine, or with pregabalin can give some result. Actually, they act on the preganglionic cell, which decrease the excitation and occupy the receptors for substance P and glutamic acid, so and increase the level of serotonin and noradrenaline. However, it can give in short, small doses, and can run the course of the treatment, because the efficacy of this treatment started after 3 weeks and to 6 months to 3 months. However, the course of the drug is depend on the individual patient. Sometimes the rheumatologist take notice about giving another drugs like ibuprofen, naproxen, Coxib, sometimes tramadol as morphine derivatives, and it could be cautious with these drugs. Thank you for your listening.